Is getting your tubes tied safe? Is it permanent? And most importantly, can you still get pregnant? Hi everyone, I'm Dr. Diana Tran Kim. I'm a board-certified OBGYN and you're watching the FemHealth channel. Today, we are answering the most important question about getting your tubes tied, which is medically referred as a tubal ligation. So tubal ligation is a surgical procedure that provides permanent birth control. During this procedure, a surgeon cuts, blocks, and seals fallopian tubes to prevent eggs from traveling from the ovaries to the uterus, which makes pregnancy impossible through natural conception. While tubal ligation is a common and generally safe method of contraception, it is a serious decision that should be made carefully. Today, we're going to discuss how safe the procedure is, whether it is truly permanent, the rare chance of pregnancy after tubal ligation, and important factors to consider before proceeding. So, is tubal ligation safe? Tubal ligation is considered safe and an effective procedure for most women. It is typically performed in a hospital or outpatient surgical center and is usually done under general anesthesia. Most people are able to return home the same day. Although tubal ligation is relatively low risk, like any surgery, it carries potential complications. There's a possibility of infection at the incision site, bleeding, or the formation of a hematoma. Some women may also experience negative reaction to anesthesia. In rare cases, there may be damage to nearby organs, such as the bowel or bladder. However, serious complications are uncommon, especially when the surgery is performed by a skilled and experienced surgeon. Most women recover quickly and are able to resume normal activities within a few days to a week. So, what are important things to consider before getting your tubes tied? Since tubal ligation is a lifelong choice, it is essential to think carefully about whether it's the right option for you. One important consideration is whether you are completely sure that you do not want any more children or any children at all. Life circumstances can change, and decisions made under pressure may lead to regret later on. Some women report feeling regret after permanent sterilization, especially if they made the decision at a young age during a stressful period of their life, such as immediately after childbirth or through a divorce. Therefore, it is important to be emotionally prepared and confident about the decision. It is also worth considering other long-term contraception options that are reversible. Devices like IUD, intrauterine devices, and hormonal implants offer highly effective birth control for several years and can be removed if you decide to try for a pregnancy. In some cases, women may choose tubal ligations for medical reasons, such as when pregnancy would present as a serious health risk or if there's a family history of genetic conditions. Even in these situations, it is important to have a detailed discussion with a healthcare provider to explore all available options and fully understand the consequences of a permanent procedure. What if you change your mind after tubal ligation? Is it permanent? Tubal ligation is intended to be a permanent method of preventing pregnancy. Unlike temporary methods such as birth control pills, intrauterine devices, or hormone implants, tubal ligation is not designed to be reversed. Although some women attempt tubal reversal surgery, the procedure is complicated, expensive, and not always successful. Even when the tubes are surgically reconnected, the chance of becoming pregnant are significantly reduced compared to women who've never undergone tubal ligation. Because tubal ligation is considered permanent, it is best suited for individuals who are absolutely certain they do not want to have children in the future. Now, is it possible you could get pregnant after your tubes tied? It is possible, but extremely rare. Although tubal ligation is more than 99% effective, experts estimate about 1 in every 200 women, or about 0.5%, may become pregnant after having their tubes tied. Pregnancy after tubal ligation can occur for several reasons. In some cases, the cut or sealed ends of the fallopian tube may naturally grow back together over time in a process known as recanalization. This can create a new passage that allows an egg to meet sperm. Another reason is that tubes may not have been properly sealed or clipped during the procedure, which leaves a small opening through which fertilization can still occur. Sometimes women may already be pregnant at the time of surgery without realizing it, and since tubal ligation does not interrupt an existing pregnancy, that pregnancy would continue. Additionally, over many years, the body's natural healing process can sometimes create new pathways, even though the procedure was successful. So what happens if you get pregnant after a tubal ligation? If pregnancy does happen after a tubal ligation, there is an increased risk of an ectopic pregnancy. This is a condition in which the fertilized egg implants outside the uterus, most commonly in a fallopian tube. Ectopic pregnancies are dangerous because they can cause life-threatening internal bleeding if not treated promptly. Women who've had a tubal ligation and later suspect they might be pregnant should watch for signs for an ectopic pregnancy. These signs include sharp abdominal or pelvic pain, shoulder pain that may indicate internal bleeding, dizziness or fainting, and vaginal bleeding. If any or all of these symptoms occur, it is crucial to seek emergency care immediately to avoid certain complications. Tubal ligation is a safe, effective, and permanent form of birth control for individuals who are confident they do not want to become pregnant in the future. Although pregnancy after tubal ligation is extremely rare, it is not impossible, and there are risks associated with these rare pregnancies, especially ectopic pregnancies. Because this procedure is generally irreversible and can carry emotional consequences, women considering tubal ligation should take time to reflect on their long-term goals and discuss the decision thoroughly with their surgeon. It is important to explore whether permanent sterilization is the right choice or if other long-term reversible contraceptive methods may suit better your needs. If you're interested in learning more about how tubal ligation compares to other birth control options or what to expect during recovery, talk to your doctor who can guide you through all your options. Thank you for listening. And if you please subscribe, click right here.